You know, regenerative medicine sounds almost indistinguishable from magic sometimes.
Oh, absolutely. It really does.
Right. I mean, the idea that you can just extract your body's own material, spin them around in a machine, and then use them to heal and restore function to aging or injured tissues, it feels like something straight out of a sci-fi novel.
Yeah, it has this very intuitive, elegant appeal to it, you
It
know? Like
does.
your body effortlessly healed your scraped knee when you were 7. So, I mean, the logic follows that it should be able to heal a degenerating joint today. We're just hardwired to trust our own biology.
We are, yeah.
Yeah.
We have this romanticized view of it.
Mm-hmm.
We assume simply reintroducing ourselves to a problem area is just going to automatically fix it. But, and this is what we're getting into today, there is a hidden variable in this biological magic.
A massive one.
And it is shocking how rarely this gets discussed, because this variable, it literally determines whether this incredible biological process actually regenerates tissue for you or whether it fails completely and just leaves you with a lighter wallet.
Yeah. And unfortunately, for a vast number of patients, that variable is completely ignored by the very clinics offering these treatments.
Exactly. So welcome to today's deep dive. Today we are focusing our lens on a highly requested procedure called the O-shot. It was invented by Dr. Charles Ronels, and it's a therapy used specifically for female sexual wellness and tissue regeneration.
Right.
But we are looking past the marketing brochures today. Our mission is to dissect the underlying mechanics. We need to understand exactly how the target platelet concentration factor, and specifically hitting that sweet spot of 4 to 6 times your blood's baseline, is the ultimate deciding factor in whether the O-shot actually works.
What's fascinating here is that we so often treat our blood like a magical elixir. We fall into this trap of thinking, well, it's my blood, it has inherent healing properties, just put it back in the tissue and let it do its thing.
Right, like he just knows what to do.
Exactly. But today we are going to look at your blood through the cold, hard lens of strict pharmacology. I mean, you wouldn't swallow a prescription pill without knowing the exact milligram dose.
Right. No, never. You'd never accept a mystery pill from a doctor who just says, take some of this.
Right. Yet people routinely accept these biological treatments without knowing the concentration of the cells they're receiving.
So if you or anyone in your circle is ever considering any form of regenerative medicine, I'm talking about anything, like joint repair for a bad knee, hair restoration, microneedling, or sexual wellness treatments like the O-shot, you have to listen to this.
It's vital.
Understanding the actual dose of your own biology is the absolute most critical question you can ask. If you don't understand the math behind the medicine, you are basically flying blind.
Yeah, and before we can even begin to calculate the amount of medicine required to trigger that regeneration, we really have to break down what the medicine actually is. Like, what is it physically trying to reconstruct in your body?
Okay, let's unpack this. Let's establish the baseline for what the patient is actually experiencing.
Yeah.
So the O-shot is a minimally invasive outpatient therapy. It utilizes something called platelet-rich plasma, or PRP, which is derived from your own blood, and then injected into very specific areas, primarily the clitoral and anterior vaginal regions.
Right, including the Skene's glands.
Yeah, exactly. And the clinical goal here is multifaceted. It's about improving physical sensitivity, increasing natural lubrication, boosting orgasm frequency, and even reducing mild stress urinary incontinence.
Which is that mild leakage some women experience when coughing or jumping.
Right, right. So what is actually doing the work there?
Well, the driving architectural force behind all of those improvements is the platelet. And most of us just know platelets for their role in clotting. You get a paper cut, platelets rush to the scene, they clump together, and you get a scab.
Like the body's emergency plumbers.
Exactly. We view them as plumbers plugging a leak. But that is merely their first job. Inside these platelets are highly complex, microscopic structures called alpha granules. You can think of them as specialized cargo ships.
Cargo ships.
Yeah, they're packed to the brim with potent signaling proteins known as growth factors.
And those growth factors are the real stars of the show here, based on the sources we reviewed.
Oh, 100%.
Because there are 3 major ones that dictate the success of the O-shot. First, there's PDGF, or platelet-derived growth factor, which basically just stimulates raw cell growth and division.
Right.
Then there's VEGF, vascular endothelial growth factor. That one promotes angiogenesis, which is the literal building of new blood vessels.
It's incredible.
And finally, TGF-beta, which triggers the production of new collagen matrix.
Oh.
So they're all doing very different, very specific jobs.
Yeah, those 3 are the heavy lifters of tissue regeneration. When a physician injects a concentrated dose of these platelets into an area experiencing tissue atrophy, which, naturally happens due to aging or hormonal shifts during menopause, childbirth trauma, those alpha granules open up.
They drop the cargo.
Exactly. They degranulate and release those growth factors,
Yeah.
which fundamentally alters the local cellular environment. They basically wake up the dormant stem cells residing in that tissue.
Okay, I was reading through the clinical breakdown of how those three factors work together, and it made me think of a construction analogy. Let me know if this tracks.
Let's hear it.
Imagine the aging or injured tissue in your body is like a dilapidated historic house. The plumbing is rusty and leaking, the wooden framing is sagging, the whole structure is just, tired.
Very relatable, yeah.
So the platelets you inject are the general contractors you hire to fix the property. And those growth factors inside them, the VEGF, the PDGF, those aren't the hammers and nails.
Right, they aren't the building materials.
Right. They are the specific architectural blueprints the contractors release to tell the local stem cells, who are the actual laborers, exactly what to do.
Yes, perfect.
The blueprints tell the workers to start rebuilding the plumbing, which is those new blood vessels via VEGF, and rebuilding the framing, which is the collagen production triggered by TGF-beta.
That analogy perfectly captures the mechanism because it highlights a really crucial misunderstanding a lot of patients have. The PRP itself isn't the brick and mortar.
It's not turning into tissue.
Exactly. The plasma isn't physically becoming new tissue. It is purely the biological signal that directs your native stem cells to initiate the repair. And the most critical part of that repair process, the plumbing in your house analogy, is angiogenesis.
The new blood vessels.
Yes, the formation of those new, delicate microvascular networks. Because in sexual wellness, blood flow is absolutely everything.
Of course.
The engorgement of tissue, the health of the mucosa for lubrication, the survival of local nerve endings, they all rely entirely on a robust blood supply. But, and this is key, that angiogenesis takes serious time to build. It is not an overnight fix.
So the patient shouldn't expect to walk out of the clinic on day one with a fully remodeled house. The workers have only just received the blueprints.
Precisely. The biological effects of the O-shot translate into functional, noticeable improvements very gradually. Like, you might feel some early changes in the first 4 to 6 weeks as the initial inflammation subsides. But the peak benefits the really profound enhancement in blood flow, the thickened tissue, the heightened nerve sensitivity that requires a full 3 months to fully realize as the tissue continuously remodels itself.
Wow, okay, so 3 months for the full remodel. So if we know that the platelets are our general contractors and they possess the blueprints to fix the house, logic tells me that you just need to drop a few of them off at the job site to get the work done.
It seems like it, right?
Yeah. They are smart cells, they know what to do. But the data we are reviewing shows that assumption is a massive misconception. It's actually the exact reason why so many of these regenerative treatments fail miserably.
Yeah. We are hitting on the threshold problem here, and it is arguably the biggest crisis in the field of regenerative medicine today.
This brings us to the biggest failure point in these clinics, the total dose and the concentration factor. Because it turns out the specific clinic you walk into entirely dictates the dose of medicine you get, and the variance between providers is just downright shocking.
It's huge.
A lot of standard clinics will just do a standard blood draw of about 10 cc. That's a pretty small standard phlebotomy tube.
Right.
And when they process that small amount of blood, it only produces, what, a 1.6 to 1.8 times platelet concentration.
Yeah, and to put that in perspective, a 1.6 times concentration is barely above the normal circulating baseline of platelets already flowing through your veins right now.
And the terrifying part is comparing that baseline to what the high-end specialized clinics are doing. The leading practitioners are drawing 60 cc's of blood.
6 times as much volume.
Right, and they process that larger volume through advanced machinery to achieve an optimal 6 times concentration factor. In absolute numbers, we're talking about delivering roughly 1.5 million platelets per microliter of plasma, compared to maybe 300,000 in the cheap kits.
The clinical heterogeneity is staggering. I mean, there are over 40 to 50 different commercial PRP systems on the market right now.
Wow.
And many of the cheaper single-spin kits that clinics buy to save on overhead produce platelet counts that essentially just mirror a patient's normal whole blood.
Okay, let me play the skeptical learner here for a second, because I think a lot of people would get tripped up by the math here.
Sure, go ahead.
Let's say I pay for this O-shot procedure. I have my little 10 cc of blood drawn. It gets spun down in a cheap single-spin centrifuge, and I essentially just get my normal blood injected back into my tissue. Why doesn't a 2x concentration work?
Well,
Like if I drop off 2 contractors instead of 6, why wouldn't they just remodel the house, I don't know, half as fast? The contractors are still at the house holding the blueprints, aren't they?
that is the logical, linear assumption most people make. But biology doesn't operate on a simple linear scale. If we connect this to the bigger picture, we have to look at the foundational research, specifically the landmark findings by Giusti and colleagues.
Okay, what did they find?
They conducted in vitro studies on human endothelial cells. Those are the cells that line your blood vessels to establish the biological reality of the minimum effective dose. And what they found was that if the delivered dose of platelets is insufficient, the biologic stimulus simply fails to reach a therapeutic threshold. The endothelial cells basically just sit there completely unchanged.
Wait, really? So it's not a slow leak of healing? The cells literally do nothing.
They do absolutely nothing. The cellular pathways for angiogenesis and tissue repair simply will not activate unless a critical mass of signaling molecules is present simultaneously.
Oh, wow.
Think about it like a complex biochemical lock-and-key mechanism. You need a massive, concentrated influx of growth factors binding to thousands of cellular receptors all at the exact same time to trigger the cascade that commands that stem cell to wake up.
So it's literally an all or nothing switch.
Exactly that. If you only inject a 2x concentration, the signal is just too weak. The stem cells essentially ignore the blueprints as background noise. The tissue doesn't repair at all. To cross that biological threshold and flip the switch, the math dictates you need roughly 3.5 to 5.5 billion total platelets delivered directly to the site.
And up to 10 billion for certain optimal outcomes, right?
Yeah, exactly.
Okay, so a 2x baseline concentration is a mathematically failed biological signal. And the 6x baseline, delivering those billions of platelets, is the sweet spot that crosses the threshold and flips the switch.
Right.
So we take that logic to the extreme. A 20x concentration would make you Wolverine, right?
Oh.
If 6x fixes a tissue, 20x must give you superhuman, instantaneous healing. Just give me all of the platelets.
It is so tempting to think that way, but once again, biology refuses to be simple.
Yeah.
It absolutely does not work like a volume dial on a stereo that you can just crank up to maximum for better results.
Yeah, the sources refer to this as a dose-response curve.
And that curve is bell-shaped. There is an ideal, highly specific range, a Goldilocks zone, which sits right between that 4x and 6x baseline.
Okay.
The data, particularly the deep dive from the MDPI research paper we reviewed, demonstrates something highly counterintuitive. Superphysiological concentrations, meaning a platelet dose that is artificially pushed way too high, can paradoxically attenuate or weaken the regenerative efficacy.
That is wild to me. Why would flooding the area with more healing factors make the actual healing process worse?
It comes down to two major biological roadblocks. The first is receptor downregulation, and the second is the unavoidable introduction of biological junk.
Okay, receptor downregulation, what is that?
When you overwhelm the local stem cells with an astronomical number of growth factors, the receptors on the cell surface can actually retract and shut down.
Oh, wow.
Yeah, it is a defense mechanism to protect the cell from overstimulation. But the even more critical issue is how you physically achieve those ultra-high concentrations in a clinic. To get to a 10x or 20x platelet count, you have to concentrate everything else in the blood, too.
It's not just pure platelets.
Right. It is never just about the pure platelet concentration. It is equally about the purity of the plasma.
Okay, here's where it gets really interesting. Because you mentioned the junk in the blood. I was trying to visualize this biological signaling problem, and I keep coming back to the idea of a live concert.
Oh, I like this.
So if you have too few musicians on a giant stage, that's your subtherapeutic dose, right? Your cheap 2x concentration from the 10 cc draw. The music is so quiet that the audience in the back row can't even hear it. The signal fails.
The audience representing the stem cells doesn't react or get up to dance.
Exactly. But if you try to overcompensate by putting 10,000 musicians on a single stage, your super physiological dose.
Yeah.
And to fit them all, you also pack the stage with all the roadies, the sound technicians, the security guards.
Oh, boy.
And you let all the crowd noise bleed into the microphones. It ceases to be music. It just becomes deafening, chaotic noise. The audience doesn't dance to that either. They just cover their ears and leave. The tissue shuts down.
That is a phenomenal way to picture the microenvironment. And in this concert analogy, those disruptive roadies and the chaotic crowd noise represent two very specific components of your blood.
Which are?
the red blood cells, and the pro-inflammatory leukocytes, which are your white blood cells. This is exactly why the physical processing equipment used by the clinic matters just as much as the amount of blood they draw. Ah, okay. To get that perfect, clear acoustic concert, you have to use a sophisticated double-spin centrifuge protocol.
Wait, how does a double spin actually change the makeup of the injection?
It uses physics to separate the cellular weights. High-end systems, like the M-site centrifuge mentioned in the literature, perform an initial, carefully calibrated spin.
Okay.
This first rotation separates the heavy, dense red blood cells from the plasma and the buffy coat where the platelets live. But they don't stop there. They extract that platelet-rich layer and subject it to a second, much faster, highly forceful spin.
So that's the step that shakes the platelets free from the junk.
Yes. It physically forces the platelets to separate from the remaining red cells and, most importantly, isolates them from the heavy leukocytes. This meticulous process creates what the industry calls leukocyte-poor PRP.
Leukocyte poor,
Yeah.
meaning low in white blood cells.
Exactly. If the clinic doesn't perform that second spin, which the cheaper single-tube kits simply cannot do, you end up leaving massive quantities of white blood cells in the final injection syringe.
But wait, white blood cells are designed to fight infections, right?
Right.
So what happens when you inject them into tissue you're just trying to heal?
They do exactly what they are programmed to do. They attack. White blood cells naturally introduce pro-inflammatory cytokines, reactive oxygen species, and proteases.
Wow.
Yeah, these are chemicals designed to chew up bacteria, but in this context, they literally create chemical noise that actively works against the delicate regenerative healing process you are trying to initiate. They literally degrade the very collagen the platelets are trying to build.
So the white blood cells are actively fighting our general contractors on the job site. They're tearing down the scaffolding as soon as it goes up.
They are causing aggressive, counterproductive inflammation when your ultimate goal is to induce smooth, organized tissue regeneration and angiogenesis.
That makes so much sense.
Right. The 4x to 6x target concentration range, when prepared in a high-quality double-spin system, perfectly balances that robust growth factor delivery without overwhelming the tissue's receptors, and crucially, without inviting that inflammatory crowd noise to ruin the concert.
Okay, put me in the patient's shoes for a minute. Let's step out of the cellular biology and into the consultation room.
Okay, let's do it.
I'm sitting on the exam table, considering dropping a significant amount of money on the O shot for sexual wellness or maybe PRP for a nagging knee injury. I'm looking at the marketing materials. How do I actually navigate this and protect myself from a biologically useless treatment?
Well, the first most reassuring thing to know is that the O-shot and PRP therapy in general is incredibly safe because the physician is utilizing autologous tissue, meaning it is entirely derived from your own body. The risk of a severe allergic reaction or your body rejecting the material is functionally zero.
Because it's just your own biology being reintroduced to you.
Exact.
But as we've clearly established today, safety absolutely does not equal effectiveness. I mean, injecting saline is safe, but it won't regrow blood vessels.
That is the crucial distinction. The safety is guaranteed by your immune system, but the effectiveness relies entirely on the provider's specific protocol and equipment. If you are going to the clinic for regenerative medicine, you cannot afford to be a passive patient.
You have to speak up.
You have to interview your doctor. You have to ask them 3 very specific technical questions before you ever consent to the procedure.
All right, let's lay them out. Question 1. What is your initial blood draw volume? If the practitioner holds up a tiny 10 cc tube, grab your coat and walk out. You're looking for a doctor who draws a volume closer to 60 cc to ensure they can harvest that critical mass of total platelets.
You simply cannot magically create more platelets in the centrifuge than what you started with in the syringe. The starting volume dictates the absolute ceiling of your final dose.
Question 2. Do you use a double spin centrifuge system? If they tell you they use a quick single-spin gel tube kit, which is incredibly common in med spas, by the way, you are paying for the inflammatory crowd noise.
Yeah, you are going to be injected with tissue-degrading leukocytes.
And the final hurdle, question 3. What is your target platelet concentration factor?
Yes.
If the provider looks confused by the question, or if they fumble and can't confidently tell you they are utilizing machinery validated to hit that 4x to 6x therapeutic threshold, you are sitting in the wrong clinic. You are about to receive an expensive subtherapeutic dose.
This raises an important question regarding how the broader medical community itself reports on these procedures and why there is so much skepticism still lingering out there.
What do you mean?
Well, for years, you would read these massive peer-reviewed clinical trials published in major journals that concluded things like PRP shows no significant benefit over placebo for osteoarthritis, or PRP yields mixed, unreliable results for female sexual wellness.
But wait, based on everything we've uncovered today, those researchers weren't standardizing or even measuring the actual dose they were giving the trial participants.
Exactly. And the industry is finally having a reckoning about this. Researchers are realizing that many of those neutral or failed clinical trials from the past decade were likely just the result of practitioners using excessively low-dose, single-spin preparations.
Wow,
They were rigorously testing the 2x concentration, seeing no results, and then universally declaring that PRP as a concept doesn't work.
that's insane. It is the pharmacological equivalent of doing a massive clinical trial on aspirin, giving every patient a microscopic tenth of a milligram, and then publishing a paper declaring that aspirin doesn't cure headaches.
That is the perfect analogy, and thankfully, the scientific community is now desperately calling for standardized reporting, mandating that every new study publish their exact platelet counts, draw volumes, and leukocyte concentrations.
So that the data is actually accurate.
Right, so that patients eventually get the dose they actually need to heal.
That is incredibly frustrating to hear that bad math held back the science for so long. But, it's also deeply validating to know the methodology is finally catching up to the variables.
It really is.
So to recap our deep dive today for you listening, the O-shot and truly all PRP-based regenerative therapies rely on your blood's platelets acting as general contractors to rebuild and restore vascular and tissue function. But the biological magic only happens when you cross a very specific threshold.
You have to hit that 4x to 6x concentration factor.
Too little, and the blueprint signal is completely ignored by the stem cells. Too much, or poorly filtered through cheap equipment, and you cause biological noise and destructive inflammation. But when you hit that Goldilocks sweet spot, you initiate genuine, lasting tissue regeneration.
It really represents a massive paradigm shift in how we view healthcare. And if I can leave you with a final thought synthesized from all the medical data we've reviewed today.
Please do.
We have spent the last century of modern medicine looking outward for healing. We constantly look for synthetic chemicals, mass-produced pharmaceuticals, and foreign substances to introduce into our bodies to fix what is broken or aging.
Right.
Yet the exact blueprints, the most precise, evolved cellular machinery required for our own repair are already flowing through our veins right now.
We are carrying the cure around with us every single day.
We are. If the only thing standing between chronic degeneration and complete tissue regeneration is a sophisticated centrifuge and a precise mathematical understanding of concentration thresholds, well, are we currently witnessing the end of traditional one-size-fits-all medicine in favor of highly personalized biomanufacturing?
Wow.
We are entering an era where your own body is the most advanced pharmacy on Earth.
Now that is a thought to chew on. The magic isn't a spell, it's just the exact right dose of you. Thank you for joining us on this deep dive. Keep questioning the consensus, keep asking your doctors the hard technical questions about your own health, and we will catch you on the next one.